today's story about something serious, something unexpected, and something that raised urgent questions in the UK. What really happened in Kent? Why did a routine health situation suddenly turn into an emergency? And how did it lead to a rapid reasons involving vaccines, antibiotics, and grow cancer among officials? Let's break it down. It started quickly. At first, there was no sign that anything unusual was happening, but then reports began to emerge. Young people falling seriously ill. What seemed like isolated isolated cases quickly turned into something far more concerning. In Kent, a dangerous outbreak of meningitis became spreading. The situation escalated fast. Within a short time, two young people lost their lives and several others became severely ill. This raised an urgent question for health authorities. Was this just a coincidence or the start of something much bigger? As case increased, officials realized they were dealing with a serious public health threat. The speed of the spread forced them to act actually quickly. The situation was officially treated as a major incident. But where was it coming from? Early investigations pointed toward close contact environments. Students, especially those living in shared accommodations, and individuals who had visited a specific nightclub were identified as potentially at risk. The discovery shifted everything. This discovery shifted everything. Health teams moved quickly. Vaccination efforts began almost immediately, focusing first on those most likely to have been exposed. Students in university housing and people connected to the identified locations were offered the MB vaccine. But that was just the beginning. As more information came in, officials expanded the vaccination program. More students and individuals who might have come into contact with infected people were included. At the same time, antibiotics were given to a wider group to prevent further spread. Still, one key question remained. Was one dose of the vaccine enough? Experts looking at the seriousness of the break of the outbreak and the risks involved decided to go further. A second dose of the MB vaccine was introduced to provide stronger and longer lasting protection against the bacteria responsible. This decision wasn't random, it was based on the need to control the outbreak quickly and reduce future risks. Health experts also pointed out something important. Crowded places, crowded places and social gatherings likely played a role in how the infection spread so rapidly. This added another layer to the situation, showing how easily such diseases can move through communities. So, what does this all mean? This wasn't just a isolated health issue. It became a clear example of how fast meningitis can spread and how critical early action is. From initial fo- confusion, initial confusion to confirmed cases to emergency response measures, everything unfolded quickly. And in the end, the answer to those early questions become clear. This was not a condition, this was not a coincidence, it was a serious breakout, one that required immediate action, a strong medical response, and public awareness to control. Takeaway: meningitis remains a dangerous disease, especially from young people in close contact environments. Quick decisions like expanding vaccinations and using antibiotics can make the difference between containment and crisis. And sometimes what starts as a few unexplained cases can turn into something much bigger than anyone expected. Thank you.